Are you experiencing chronic gut issues and you're really trying to get to a point where you can really uncover some of the root causes? Well, today we're going to talk about one root cause of many that is actually scar tissue. So this can be from things like appendectomies, laparoscopies, endometriosis, C-sections. And when we can begin to address the mobility and motility of the tissue, then we can really begin to see changes in our gut and our gut-brain axis. Hi, my name is Dr. Arianne Missimer. I'm a functional medicine practitioner, doctor of physical therapy, registered dietitian, and I'm the owner of the Movement Paradigm Integrative Health Center. And I'm super excited to talk about this today because I always find that this is one of the areas that we really want to look at when looking at a comprehensive whole body wellness plan. So whether you are experiencing something like SIBO, small intestinal bacterial overgrowth, or IMO, intestinal methanogen overgrowth, maybe you're experiencing leaky gut, maybe you have inflammatory bowel disease, maybe you have just chronic bloating and digestion issues. So the first thing that we always want to think about as number one is our nervous system and understanding where we are we in a safe place in our body to heal? But beyond that, today we're going to talk a little bit more about the mechanical aspect and specifically scar tissue. So in our normal fascial tissue, we have collagen fibers that are like this. When we have scar tissue, think that we are going to have these cross links where the fibers are going to become stronger. Okay, so they're in these cross links, cross bridges. Stronger tissue, not as elastic. So it's really important that we are able to have the adaptation to create scar tissue to begin with. However, we want that tissue to be really elastic and hydrated. So when we're thinking about how our scar tissue and how our fascial tissue works, is that this is a beautiful representation of this tensegrity model. So if I am going to create tension on one area, it's going to influence all of the other structures, not just locally, but also distally, so far away from the structure. So ultimately, we're creating tension and we're creating integrity and elasticity in the tissues. So what happens when we have scar tissue, whether it's from any of the things that I mentioned, we can ultimately have tissue that's really tight in some areas, and then it can affect the mobility of the organs. The mobility of the organs should move anywhere from 1 to 3 centimeters. And we also have motility of the organs, which allow this, what we call an inspire and an expire. Think of it like a rhythm or a breath of each individual organ. And it will start to limit the mobility and motility of these organs. So then what happens? They don't function as well. So we have to begin to think about how this scar tissue, how these potential adhesions are affecting the mobility and motility of the organs, how it's affecting our lymphatic system, which is extremely important because we have so much lymph in our gut. So we have the gut-associated lymphoid tissue, which is going to really, we end up dumping lymph into what's called the cisterna chylae. And that is a major part of our lymphatic system. So when we're thinking about trying to heal our gut, we need to optimize our lymphatic system. We need to create mobility. We need to have great elasticity of the tissue so that they can slide and glide very freely. Okay, so how do we do this? So I'm going to show you just a pretend scar here so you can see a good little visual. So if this was the scar that was on the abdomen, anywhere. So let's say this was a C-section scar or, like I said, an appendectomy. What we're going to do is to assess the scar. So you can do this, of course, lying down. You would come around the scar and you can pull it in different directions. So let's say from here, it looks like, wow, I can pull the tissue really far. But if I come down here and I pull, see how it doesn't move as far. If I come on the other side, doesn't move as far, and so on. So what I'm doing is assessing the mobility of the scar itself. But of course, we can, as I mentioned, because the scar tissue is going to affect so many surrounding and distant areas, we can come around the scar and see where is this tissue moving and gliding freely, and then where is it restricted. So we want to think the lymph is right under the skin. So when we have these restrictions, these myofascial restrictions, then we begin to have poor lymphatic flow, and the lymph is directly tied to the gut. So that is going to 100% affect how we are actually healing. So when you figure out how you've assessed the scar, now you can begin to do, I'm going to just show you a couple techniques today. One is going to be a circular technique. So we start from here, and you can see I'm moving the skin over the tissue. Okay, so I'm going to come right over the scar, moving the skin right over the tissue in just a circular motion. You do this with one finger, can reverse directions. And ideally, you start to assess. So, oh, wow, it's really tight here. Oh, it's really tight here, right? So you start to kind of get a little bit more information as you start to work on it. We can also do what's called a smudging technique. So here, I'll put my finger right over the scar. I'm going to go up and down, up and down. You can go side to side. Of course, you can go diagonals. And again, not just on the scar, but you can start to work on the surrounding area. When you get really comfortable, you can actually begin to move into other areas. So especially around the pelvic girdle. So if you go over that iliac crest, which is your big hip bone, if there's a C-section scar, for example, you're going to feel a lot of restrictions in that area. So that's a great way to start to work that tissue. And initially, what I'm showing you today is a very isolated approach to addressing specific scar tissue. What I want to remind you is that you are not breaking up anything. So you need thousands and thousands of pounds of force to break up scar tissue. So we are not doing that, but we are allowing this reorganization of fibers. We are creating better fluid dynamic to the area. So we're ultimately going to promote better lymphatic flow. And the last benefit, which is huge, is that we're using the sensory information. So our fingers, using it on our direct skin contact, we are influencing what we call our anterior insular cortex in our brain. So we have tons of free nerve endings in our fascial tissue. And when we can begin to influence the fascia and we can begin to influence the viscera, then we are actually influencing the emotional regulation of our brain. So all really powerful wins as it relates to getting to the root cause of your gut or digestive issues. So we want to remember that it's typically not one root cause, it's more normally root causes. And this can be just one aspect of a more comprehensive program. So I hope this was helpful for you. If it was, please give a like and give a share. And of course, subscribe to our YouTube channel for weekly tips on nervous system regulation, functional medicine topics, as well as holistic physical therapy and pain relief. And if you'd like to reach out to us for a discovery session, we'd love to hear from you. So feel free to schedule a discovery call. And you can also consider joining our app community, The Movement Paradigm, on Google and Apple. We have a great community where we do really focus on whole body wellness. So would love to help you in any way. And if you have ideas for topics, please drop them in the comments below. We would love to hear. Thank you as always for your support. Good to see you.